talking today to Dr. Allon Barsam. Dr. Barsam is a UK ophthalmic surgeon. Hi, Allon. Thank you so much for allowing me to interview you for Askimo TV's online library of Interview with Experts.
Hi, Joanne. Thank you. It's a pleasure to be here.
Great. Allon, the first thing we're going to talk about today is cataracts and cataract surgery. So I guess the first question is, what is a cataract?
Cataract is a clouding of the natural lens inside the eye. The lens is basically the part of the eye that focuses light behind the iris, which is the coloured part of the eye. So everyone has this lens, and as we get older, the lens can become bigger and more cloudy, which interferes with vision. When it starts interfering with vision, either in terms of blurred vision or causing glare in sunny conditions, then it's a significant cataract at that point.
Who gets cataracts and why?
Everyone gets cataracts. In those over 60 years of age, the prevalence is about 60%. So 6 out of 10 people that are 60 years and above will have some degree of cataract, albeit not all of them will be significant. And at the age of 80, 100% of people have cataract. So at the age of 80, everyone has a cataract. But again, not all of those are significant. So it is essentially an inevitability of aging. And that is by far the main reason for getting cataracts. There are other reasons. So for example, diabetes is a reason. People can have congenital cataracts, so people could be born with them. Anyone taking steroid, either as a pill or as drops, eventually can get cataract. But by far the most common reason is just age.
And under what conditions would it be necessary to operate?
Well, if someone is symptomatic, so if someone is complaining of symptoms that are associated with their cataract, and it's interfering with things they like to do, so if they're finding it difficult to watch television or read, or they're getting glare when they're driving in sunny conditions, or they just find it difficult to drive at night or at certain times, then at that point we have a discussion about what's involved with the surgery, and a patient is offered the choice of having the cataract operation at that point. Most people will elect to undergo surgery, given that cataracts tend to get worse. So as soon as they notice symptoms, they know that those symptoms are likely to just worsen with time, and that's what we do.
So if you were going to do the procedure with somebody, tell me, briefly what somebody can expect to happen during the procedure and what you would do to correct the problem.
Well, everyone does procedures in slightly different ways, and it does depend to some extent on what a patient wants. So I do try and tailor my treatment to the needs of an individual patient. But in general, I do the surgery with anaesthetic drops, so I spare a patient any kind of anaesthetic injection. The operation itself takes around 10 to 15 minutes for each eye. We don't tend to do both eyes at the same time, and we will separate each eye by about a week or 2 weeks. Often if a person has cataract in one eye, they will also have one in the other, so you have one eye done, and then a week or two later you have the second eye done. The operation itself is completely painless, and what we do is we replace the cloudy cataract lens with an artificial lens that is tailored to the length and curvature of the patient's cornea. So the length of the patient's eye and the curvature of the patient's cornea. Cornea is the clear, natural contact lens of the eye, and those two things determine how much power you need in a lens in order to make it so that someone will not need glasses after cataract surgery. And nowadays, certainly for a cataract specialist such as myself, the ability to remove the need for someone to wear glasses is a big part of the cataract operation. We have the option of making it so that someone doesn't need glasses for distance, or there are certain kinds of lenses that you can put in so that someone won't need glasses for reading at distance or for reading close up.
What should I do or not do to avoid post-op complications and to recover properly from the surgery?
Well, I tell people that they should avoid heavy lifting for 2 weeks. They should make sure that they don't poke their eye or knock their eye. There will be some drops to take afterwards, and I normally give them 2 different kinds of drops to take 4 times a day for 2 weeks. Then they stop one of those drops, and there's a second drop to take for a further 2 weeks, just twice a day. I tell people not to do things like gardening or anything where they can get dirt or dust in their eye. If people are do a physical job, then I tell them to take 2 weeks off work. But if people do a desk job or something like that, then often they can be back at work after just a few days. It's not an operation that makes people feel unwell. You know, it's a short procedure. People come in and go home on the same day, and often the next day their vision is already beginning to improve upon what it was previously, and after 2 or 3 days then they notice significant improvement in vision.
Are there any risks to the procedure?
Yes, there are risks with any kind of operation, and the main risk in cataract surgery is infection or bleeding, which is normally not preventable. If it's going to happen, it will just happen. Fortunately, the risk is incredibly low, and the risk of vision being significantly worse than it was before due to a problem like that is probably in the region of 1 in 2,000. It's incredibly rare, and most people are delighted with the outcome of surgery. So of all the operations that are done on all different parts of the body, I think possibly with the exception of laser vision correction, cataract surgery is the safest and most predictable operation that we do.
Can the cataracts return?
No. Once you've done cataract surgery, the results are permanent. However, about 1 in 10 to 1 in 20 people will get a clouding of the what we call the capsular bag, which is like a cling film shrink wrap that surrounds the natural lens of the eye, and the skill of surgery involves preserving that so that natural cling film will encase and support the artificial lens. Now that cling film can become cloudy at some point several months or even years after cataract surgery. It's a process called capsular opacification. And if that happens, what we then do is a laser procedure, which is quick, painless, and very safe. It takes a few minutes to do, and that creates a permanent opening in the back of that shrink wrap capsular bag. It doesn't involve any cutting in the eye. Patients have it done in the outpatients, sitting up, and that permanently resolves that problem if it were to occur. So essentially, having had the operation, and then in the unlikely event that you then need that laser a few months or years later, results thereafter will be permanent.
Thank you, Dr. Barsam. Thank you so much for talking to me today.
Joanne.